Hey there, fellow learners. Welcome back to our channel, Equation by Pharmacist Moms, where we're dedicated to bringing you valuable content to enhance your knowledge and skills. This is an educational series on mastering medication dosing. In this episode, we'll delve into the essential calculations involved in determining proper doses for various medications. If you're enjoying what you're seeing and want to stay updated on all the latest insights, tips, and tutorials we have to offer, make sure to hit that subscribe button below. Don't forget to give this video a thumbs up if you find it helpful. Your likes not only show us your appreciation, but also help others discover this content. And if you've got friends, colleagues, or anyone else who could benefit from this video, be a hero and hit that share button. Let's spread the knowledge far and wide. Your support means the world to us and motivates us to keep delivering top-notch content. Now, without further ado, let's dive into today's topic. Calculating medication doses accurately is a critical skill for healthcare professionals. Whether you're a pharmacist, nurse, or physician, understanding the fundamentals of dosage calculations is essential for safe and effective patient care. From tablets to liquid formulations, dosage forms vary widely, each requiring specific calculations to ensure precise administration. Throughout this series, we'll cover everything from basic conversions to more complex dosage calculations, providing you with the knowledge and confidence to tackle any dosing scenario. So, whether you're a seasoned healthcare professional looking to refresh your skills or a student eager to learn, join us on this journey to mastering medication dosing. Let's dive in and unlock the secrets to precision dosing. In this video we'll learn dose definitions, teaspoon and tablespoon, the drop as a unit of measure, and general dose calculations. Let's begin. The dose of a drug is the quantitative amount administered or taken by a patient for the intended medicinal effect. The dose may be expressed as a single dose, the amount taken at one time, a daily dose, or a total dose, the amount taken during the course of therapy. A daily dose may be subdivided and taken in divided doses 2 or more times per day, depending on the characteristics of the drug and the illness. The schedule of dosing, for example, for times per day for 10 days, is referred to as the dosage regimen. The usual adult dose of a drug is the amount that ordinarily produces the medicinal effect intended in the adult patient. The usual pediatric dose is similarly defined for the infant or child patient. The usual adult and pediatric doses of a drug serve as a guide to physicians who may select to prescribe that dose initially or vary it, depending on the assessed requirements of particular patient. The usual dosage range for a drug indicates the quantitative range or amounts of the drug that may be prescribed within the guidelines of usual medical practice. Drug use and dose information is provided in the package labeling and inserts that accompany manufacturers' pharmaceutical products, as well as in a variety of references. The median effective dose of a drug is the amount that produces the desired intensity of effect in 50% of the individuals tested. The median toxic dose of a drug is the amount that produces toxic effects in 50% of the individuals tested. For certain drugs, a correlation exists between drug dosage, the drug's blood serum concentration after administration, and the presentation and degree of drug effects. An average blood serum concentration of a drug can be measured, and the minimum concentration determined that can be expected to produce the drug's desired effects in a patient. This concentration is referred to as the minimum effective concentration, or MEC. The base level of blood serum concentration that produces dose-related toxic effects is referred to as the minimum toxic concentration, or MTC of the drug. Optimally, appropriate drug dosage should result in blood serum drug concentrations that are above the MEC and below the MTC for the period of time that drug effects are desired. For certain drugs, a larger than usual initial dose may be required to achieve the desired blood drug level. This dose is referred to as the priming or loading dose. Subsequent maintenance doses, similar in amount to usual doses, are then administered according to the dosage regimen to sustain the desired drug blood levels or drug effects. In calculating doses, pharmacists and physicians accept a capacity of 5 milliliters for the teaspoonful and 15 milliliters for the tablespoonful. It should be noted that the capacities of household teaspoons may vary from 3 to 7 milliliters, and those of tablespoons may vary from 15 to 22 milliliters. Such factors as viscosity and surface tension of a given liquid, as well as the technique of the person measuring the liquid, can influence the actual volume held by a household spoon. Occasionally, the drop, abbreviated GTT, is used as a measure for small volumes of liquid medications. A drop does not represent a definite quantity because drops of different liquids vary greatly. In an attempt to standardize the drop as a unit of volume, the United States Pharmacopoeia defines the official medicine dropper as being constricted at the delivery end to a round opening with an external diameter of about 3 millimeters. The dropper, when held vertically, delivers water in drops, each of which weighs between 45 and 55 milligrams. Accordingly, the official dropper is calibrated to deliver approximately 20 drops of water per milliliter. It should be kept in mind that few medicinal liquids have the same surface and flow characteristics as water, and therefore the size of drops varies materially from one liquid to another. Most manufacturers include a specially calibrated dropper, along with their pre-packaged medications, for use by patients in measuring dosage. A pharmacist often needs to calculate the size of a dose, the number of doses, or the total quantity of medication to dispense. For these calculations, this equation is useful, with the terms rearranged, depending on the answer required. In using the equation, the units of weight, or volume must be the same, for the total quantity and size of the dose. Thank you for joining us for this first episode of our Mastering Medication Dosing series. We hope you found it informative and engaging. To stay updated on future episodes and access additional resources, be sure to subscribe to our YouTube channel, Equation by Pharmacist Moms, like this video, and share it with your colleagues and friends. Also, don't forget to follow the blog, equationbypharmacistmom.blogspot.com, for in-depth articles and bonus content. Link is also mentioned in the description. Your support helps us continue to create high-quality educational content. Together, let's empower healthcare professionals everywhere to master medication dosing. See you in the next episode.